So with the new devices which are there, you can wheel in the patient within a few minutes and you can treat the patient and the patient recovers, and probably after 48 hours, he can go home.
So it's a great pleasure to be here at the PVI in Paris. This is a wonderful place. And today I will be with Dr. Singh from New Delhi. So nice to meet you.
Pleasure.
So please, can you introduce yourself?
Yes, I'm Dr. Varinder Singh Bedi. I'm Chairman, Institute of Vascular and Endovascular Sciences, Sir Gangaram Hospital in New Delhi. It's my proud privilege to be out here at this wonderful meeting, the PVI 2025. I'm really delighted to be here. I've been here for the last 2 days and I'm enjoying the sessions out here. So thank you so much for the invite.
Okay, great. So my name is Fabien Lareyre. I'm consultant vascular surgery in the south of France at the Hospital of Antibes. And today you would speak about pulmonary embolism.
Yeah.
And what you're doing in India, or more in New Delhi, or in India in general.
Yeah.
So please feel free to
So I
tell
think,
us more.
as you know, pulmonary embolism is one of the leading causes of death, cardiovascular mortality. Almost 1/3 of the patients who have pulmonary embolism, they can have pulmonary embolism, and that is one of the major causes of mortality. And what we've seen is almost 25% of these patients who are there, they can potentially die because of this pulmonary embolism. Over the years, the treatment was much more conservative earlier and all, but I think now with the availability of new devices, I think the results have become much better. So the mortality.
So you're saying before it was more conservative, so more like
Yes.
just medical treatment.
Correct.
And
Yeah.
now it has changed, right?
Exactly,
Okay.
exactly. Because earlier the only way to treat them was either with some anticoagulation or give them some thrombolytic therapy and all. But again, many a times, especially patients who had massive pulmonary embolism, the therapy would not really be that efficacious in the immediate look for an emergency. So if a patient was unstable and you subject him to a lytic therapy, which is going to take many hours to recover, the patient might not survive that. So with the new devices which are there, you can wheel in the patient within a few minutes and you can treat the patient and the patient recovers, and probably after 48 hours, he can go home. So I think that is what the technology has changed, been a paradigm change.
So you're okay, great. So technology changed the game.
Yeah.
But in India, for example, do you think all patients can have access to this kind of tools or treatment?
Yeah, not all patients can have access to this treatment because there are certain limitations in a country like India. It's a big country, so facilities are not really available at every center. So the only thing which is there is any patient who is able to reach a good tertiary care center can get treated, and you can treat the patient. But yes, a lot of patients are still deprived of the treatment because of non-availability of resources, I would say, and at the same time expertise also. I think these two things are the most important part for the outcome analysis of these patients.
So you have a strong expertise in the field. So maybe you can tell us more about the endovascular treatment that you're performing in your center, and more about your experience.
Yeah. So I think again, I have been a vascular surgeon for almost now about 30 years now. And today I head the largest department in India, which is a vascular surgery center. We have excellent resources out here. And that is what I'm saying, that in the last 3 to 4 years, in fact, with the availability of the devices which have come in now, earlier they were not available in India, they have changed the thing, because you can just through a small puncture, you can basically go inside the catheter, go inside into the pulmonary arteries, you can suck out the major clots and get rid of the thrombus and all burden out there and treat the patient symptomatically after that. So I think the most important part out here is basically saving lives because of a preventable complication. Massive pulmonary embolism is like, it can just happen suddenly. It is many a time labeled as a cardiac event, that you had a heart attack, but it is not really a heart attack. It is pulmonary embolism because you suddenly have breathlessness and you collapse. So that's the challenge out there.
Oh, great. And in terms of volume, because India is the most important population in the world,
Yes.
and New Delhi, lot of people.
Yes.
In terms of volume, can you tell us more
Yeah.
about your experience?
So Earlier, in fact, there were very few patients who would be referred to us for treatment of pulmonary embolism because the specialties, especially the pulmonologists, the cardiologists, they themselves were not aware. And what we have seen, in fact, I've got it in my presentation that we got this curve going up like this. So now we are seeing at least about 25 odd patients every year coming with pulmonary embolism and getting treated. Earlier, we would probably see about 5 or 6 patients, and most of them were being managed by the cardiologist or the pulmonologist and conservative treatment. So not really getting any solution.
Yeah. So with the increase of the endovascular era, more and more practitioner can perform this kind of intervention.
Absolutely.
So is there a big fight, for example, with interventional radiologists, cardiologists, vascular surgeon? How does it work in your center?
Yes. So I think that's a great question that you asked out here. Like everywhere, there's a bit of a turf war right now. But fortunately, pulmonary embolism is one, disease which primarily either goes to the cardiologist, the pulmonologist, or a vascular surgeon. They know whom to refer because the interventional radiologists don't really do this kind of work and all so far in our country. But yes, there's a potential that sometimes they may pick it up and all. But right now, I think it is under the domain of the vascular surgeons.
And and do you have any tips or tricks to tell to other specialists as a vascular surgeon? I'm sure
Yes.
you're not performing
Yeah.
the same procedure as a cardiologist will do. So
Yes.
maybe you will have more tips to
Yes.
tell
I
us.
think I think awareness and all and social media presence and all is a very, very important part. That we go across, we conduct CME activities and all. We meet physicians, we meet all this kind of the people who are treating these patients, and we or rather who are referred these patients and all, especially pulmonologists. We need to sensitize them, and they themselves, once we have treated a patient, they see the remarkable outcome which is there and all, and then after that they are convinced that okay, this patient needs to be sent to a vascular surgeon. I think
Okay,
that's very important.
great. So thank you. I think it was really nice to talk to you. It's really nice to have some insight from other country.
Yeah.
So thank you very
Thank
much for
thank you so
this
much for
kind
the
of
interview, and it's
interview.
been an amazing experience coming to Paris and meeting some wonderful people out
Okay.
here also.
So I hope to see you next year at the PVI.
We look forward to doing that.
Yes.
Sure. All
Thank
right.
you.
Thank you.